Imagine this. You wake up in the morning. Before you even touch your phone, your watch already knows your heart rate. Your ring has studied your sleep. A tiny sensor on your arm has watched your glucose all night. Your phone has noticed that you have moved less than usual. And somewhere, deep inside an app, an algorithm is quietly asking one question. Is something changing in your body before you can feel it? This is the promise of real-time health monitoring. For most of human history, health was quiet until something went wrong. We felt pain, a fever came, breathing changed, the heart started racing. Then we went to a doctor, took a test, and waited for an answer. But now, that story is changing. Today, health is becoming a live signal, not once a year, not only inside a hospital, not only when we are sick, but every minute, every hour, every day. The big question is simple. How close are we to real-time health monitoring? The answer is powerful but also complicated. We are close, very close in some areas, but we are not fully there yet. Let's start with what is already real. Your heart is one of the first parts of the body that modern wearables learn to monitor. Many smartwatches can track heart rate continuously. Some can record a simple ECG. Some can warn users about irregular rhythms that may look like atrial fibrillation, a common heart rhythm problem. This does not mean your watch is a doctor. It does not mean it can detect every heart disease, but it can notice certain patterns. It can say something looks unusual. You may need to check this. That one alert can be important because the heart often whispers before it screams. Another area that is already real is glucose monitoring. For people with diabetes, continuous glucose monitors have changed daily life. A small sensor sits under the skin and tracks glucose levels in the fluid around the cells. It can show whether glucose is rising, falling, or staying stable. Instead of guessing, people can see the pattern. This is real-time health monitoring in action. But here is the mystery. Not all real-time claims are equal. A glucose sensor that actually touches the body's fluid is very different from a smartwatch that claims to measure glucose without piercing the skin. Right now, many non-invasive glucose claims are not ready for medical decisions. This matters because a wrong glucose number can be dangerous. So we are living in two worlds at once. In one world, real medical sensors are already helping people. In the other world, some marketing promises are running faster than science. The same is true for blood pressure. Blood pressure is one of the most important health numbers in the world. High blood pressure can be silent for years. It can damage the heart, brain, kidneys, and blood vessels without warning. Imagine if a watch could track blood pressure all day without a cuff. That would be huge. Researchers and companies are working hard on cuffless blood pressure monitoring. Some ideas use light sensors, some use electrical signals, and some use artificial intelligence. The dream is simple: continuous blood pressure from the wrist without squeezing your arm. But blood pressure is difficult. Your wrist moves, your body position changes, your temperature, stress, caffeine, exercise, and even the tightness of the device can affect the signal. So the challenge is not just measuring something, the challenge is measuring it correctly in real life. And real life is messy. This is the heart of the whole topic. Real-time health monitoring is not only about sensors, it is about trust. Can we trust the number? Can a doctor use it? Can an alert save time instead of creating fear? Can the system understand the difference between danger and normal human variation? Because the human body is never still. A real-time health system must not only collect data, it must understand context. This is where artificial intelligence enters the room. AI can look at long patterns. It can learn your personal baseline. It can notice that your normal is not the same as another person's normal. For one person, a resting heart rate of 55 may be normal. For another, 90 may be normal. The future of health monitoring will not be one universal number. It will be personal. Your body has a rhythm. AI may help detect when that rhythm changes. Imagine your wearable sees that your resting heart rate is higher than normal, your sleep is disturbed, your skin temperature is rising, and your activity is dropping. Alone, each sign may look small. Together, they may suggest that illness is coming. That is the magic of real-time monitoring. Not one signal, but many signals together. Heart rate, sleep, temperature, breathing, movement, glucose, blood oxygen. blood pressure, stress markers, maybe one day even early signs of infection, dehydration, inflammation, or hormone changes. But we must be careful. More data does not always mean more health. Sometimes more data creates more anxiety. A person may wake up feeling good, check a sleep score, and suddenly feel tired because the app said the night was bad. Someone may see a strange number and panic, even if it is just a sensor error. This is the dark side of constant tracking. Health monitoring should give people power, not fear. That is why design matters. The best future is not a screen full of numbers. The best future is clear guidance. Not here are 500 data points, but your pattern changed. Rest today, or this may need medical attention, or this looks normal to you. Real-time health monitoring should make life simpler, not more confusing. Now let's talk about hospitals. In hospitals, real-time monitoring has existed for a long time. Patients in intensive care are connected to machines. But the new revolution is that monitoring is leaving the hospital. It is moving into the home. This is called remote patient monitoring. A patient with heart disease, diabetes, high blood pressure, or lung disease may use connected devices at home. Data can be sent to a care team. If something changes, doctors or nurses may respond earlier. That future is not science fiction anymore. But there is a second mystery. Who owns the data? Your health data is not like normal data. It can reveal your sleep, stress, habits, illness, weakness, and risk. It can show what even your own mind may not fully know yet. So privacy is not a small issue. It is central. If real-time health monitoring becomes normal, we need strong rules. Who can see the data? Can insurance companies use it? Can employers request it? Can apps sell it? What happens if it is hacked? A future where your body is constantly measured must also be a future where your rights are protected. Without trust, people will reject the technology. Now, let's answer the main question clearly. How close are we? For heart rate, sleep trends, activity, ECG snapshots, irregular rhythm alerts, oxygen trends, and continuous glucose for certain users, we are already here. For full medical grade, always-on, accurate, low-cost, non-invasive monitoring of everything important, we are not there yet. We are somewhere in the middle. We can monitor many signals, but we cannot perfectly understand all of them. We can detect some risks early, but we cannot predict every disease. We can bring data to doctors, but we still need doctors to judge the meaning. We can make devices smaller, but we must make them fair, affordable, private, and clinically reliable. The next big step will be integration. Today, your watch has one picture. Your glucose sensor has another. Your medical record has another. Your doctor has another. Often, these systems do not speak the same language. The future will connect them. Your wearable data, lab tests, medical history, medicine, lifestyle, and symptoms may come together into one intelligent health picture, not to replace doctors, but to help them see earlier and more clearly. This is where real-time monitoring becomes real-time care, because data alone is not healthcare. Action is healthcare. The true goal is not to know every number. The true goal is to catch danger early, prevent disease, guide treatment, and help people live better lives.